Welcome back to the deep dive. Today, we're tackling a really tough topic, neonatal foal meningitis. We've gathered a lot of detailed sources, and our mission is to unpack why it's so dangerous, how it's spotted, and what the latest treatment approaches are.
And it really is something that needs immediate focus. Neonatal foal meningitis, it's a severe inflammation, basically, of the membranes covering the brain and spinal cord. But the crucial thing to grasp is that it's almost always a secondary issue. It pops up because of widespread blood poisoning, septicemia. So acting fast and aggressively isn't just advised, it's potentially life-saving.
Okay, so let's lay that foundation then. What exactly is it, and why is it just so devastating for these newborn foals?
Right. So at its simplest, it's that inflammation of the meninges, like you said, those protective layers. But the severity comes from its connection to septicemia. You've got bacteria that have already spread throughout the whole bloodstream. And these bacteria, they literally travel from that systemic infection right into the central nervous system. We see this most often in really young foals, less than 2 weeks old usually. The real danger, though, is how fast it moves. If you don't jump on it with aggressive treatment right away, it's almost always fatal.
That sounds incredibly serious. So if this widespread bacterial infection, this septicemia is the root problem, what usually kicks that off? What makes the foals so susceptible to begin with?
That's the key question. It all starts with that bacterial infection leading to septicemia. And the single most significant risk factor, that's failure of passive transfer, FPT. This is when the foal just doesn't get enough of those vital antibodies, the IgG, from the mare's first milk, the colostrum, those first few hours. When their IgG levels are low, say under 400 milligrams per deciliter, and honestly, often it's way lower, like under 200, their immune system is just wide open, really vulnerable.
Wow. Okay, so that initial immunity gap is huge.
Huge. And then other things can pile on. Environmental factors matter a lot. Poor hygiene where the foal is born. That can let bacteria sneak in through the umbilical stump that's navel ill, or maybe the respiratory tract, even the gut. Sometimes the problem starts even before birth. In utero infection, like placentitis, means the foal might be born already septic.
Already behind the curve.
Exactly. And then you have foals that are already compromised for other reasons. Maybe they're premature or dysmature or have that dummy foal syndrome, neonatal encephalopathy. Their immune systems are just weaker, less ready to fight. They're at much higher risk.
It sounds like a perfect storm of vulnerability factors.
Yeah.
Are there specific types of bacteria we should be aware of? The common culprits.
Yeah, there are quite a few usual suspects. On the gram-negative side, you often see E. coli, Klebsiella, Actinobacillus, sometimes Salmonella, but gram-positives are common too, things like Streptococcus, especially S. su epidemicus, and Staphylococcus species. It's quite a range of potential bugs.
Okay, so these bacteria are causing chaos systemically. How do they make that jump? How do they get to the brain and spinal cord to cause the meningitis itself?
Good question. The main route by far is what we call hematogenous spread.
Through the blood.
Exactly. The bacteria are already in the bloodstream because of the sepsis, and they travel through the circulation and manage to cross the blood-brain barrier. That's the most common scenario. Less often, you might see local extension, say a really bad infection right next door, like in the umbilicus, or maybe a vertebra. It could potentially spread directly to the meninges. And trauma is rare as a primary cause, but severe head or spinal injury could damage that blood-brain barrier, creating an opening.
Given how fast this moves and how many other things can be going on, I imagine spotting it must be incredibly tough. How do vets approach diagnosis when the early signs might be, kind of vague?
You nailed it. That's a huge challenge. The early signs often mimic other serious problems in newborns, like just severe sepsis in general, or even that dummy foal syndrome. So you need a really high index of suspicion. You have to be watching constantly for subtle changes.
What kind of signs are we talking about?
Well, you often see a mix. First, there are the non-specific signs you see with pretty much any septic foal. Things like being really depressed, lethargic, not wanting to suckle, poor nursing, just general weakness. They might have a fever, or actually be cold, hypothermic, heart rate, breathing rate usually up. Mucous membranes might look really red, hyperemic, maybe even tiny pinpoint hemorrhages, petechiae. And you're also looking for clues of infection elsewhere, like swollen joints, maybe an obviously infected navel, diarrhea, or signs of pneumonia.
Okay, so those are general red flags. What points more specifically towards meningitis?
Right. Then you have the neurological signs. These are more specific. Changes in mental state are a big one. The foal might seem dull, confused, stuporous, even comatose, or show no interest in the mare. Seizures are another major sign. These can range from just little facial twitches to, full-blown paddling convulsions.
Oh,
Yeah. Then there's incoordination, ataxia,
no.
weakness, difficulty moving limbs properly, that's paresis. Problems with cranial nerves, weird pupil responses, maybe involuntary eye movements, nystagmus, a head tilt, crossed eyes, facial paralysis, trouble swallowing, sometimes neck pain or stiffness, or really abnormal postures like opisthotonus, that severe arching back of the head and neck, or compulsive stuff like head pressing against a wall or circling. The key thing is these signs usually get worse, often rapidly. And unfortunately, things like severe seizures or coma, those are usually late signs, and they mean the prognosis is, well, pretty grim.
That's a sobering list.
Hmm.
So beyond observing the foal, what lab tests are crucial to actually confirm what's going on?
Labs are absolutely essential here. You'd start with a complete blood count, a CBC. That'll usually show signs of the systemic inflammation, messed up white blood cell counts, maybe more immature cells, high fibrinogen, all pointing towards sepsis. Checking the serum IgG level is also vital. We need to know if failure of passive transfer is involved because, as we said, that's a huge risk factor.
Right.
Then, to actually nail down the sepsis itself, a blood culture is the definitive test. It tells us which bacteria are causing the systemic infection and helps figure out the best antibiotics. But for meningitis specifically, the absolute gold standard is analyzing the cerebrospinal fluid, the CSF.
Then you get that.
It requires a specialized procedure, either a lumbar tap or an atlanto-occipital tap. Needs real expertise, usually done at a referral hospital. And when you look at that CSF, normally it's clear, colorless. But with meningitis, it might be cloudy, murky, maybe yellowish. You expect to see a huge increase in the cell count. We call it pleocytosis, mostly those damaged neutrophils, like hundreds of cells per microliter compared to normally less than 10.
The difference.
Huge. Protein levels are usually up too, and glucose is often down because the bacteria are literally eating it.
Yeah.
And crucially, you culture the CSF. That helps identify the specific bacteria in the central nervous system and figure out which antibiotics will work against them. A gram stain on the CSF can also give an early clue.
Makes sense. What about other cultures?
Yeah, definitely. If you suspect the infection started somewhere else, like the navel or a joint, you'd want to culture those sites too.
Is imaging like MRI or CT ever helpful for these foals?
Well, ultrasound can be useful, for checking out the umbilicus or maybe looking at joints if you suspect an infection started there. But advanced imaging of the brain and spinal cord itself, like MRI or CT, it's actually rarely done in live foals with suspected meningitis. The logistics, the need for anesthesia in a critical foal, the cost, it usually just isn't practical in these emergency situations.
Okay, so diagnosis is complex, relies heavily on clinical signs and CSF analysis. Once you do suspect or confirm meningitis, you mentioned aggressive treatment is a race against time. What does that actually look like on the ground?
It is absolutely a race. The treatment is incredibly intensive, it's prolonged, and it really focuses on three main things. Hitting the infection hard, reducing that dangerous inflammation in the brain and spinal cord, and just providing round-the-clock supportive care.
Let's start with the infection.
Yeah.
Antibiotics.
Absolutely critical. Antimicrobial therapy. You start broad-spectrum, potent bactericidal antibiotics immediately, like as soon as you suspect meningitis, even before you get culture results back. And the key criteria, they have to be able to get into the central nervous system effectively, cross that blood-brain barrier.
Which ones work well for that?
Common choices often include third or fourth generation cephalosporins. Cefotaxime is often a go-to because it gets into the CNS pretty well. Others like ceftriaxone or cefepime might be used too. Chloramphenicol is another strong contender. Excellent CNS penetration, hits a wide range of bacteria, but you do have to monitor carefully for potential side effects like bone marrow issues. Sometimes trimethoprim sulfa, TMS, is used. It gets into the CNS well, but resistance can be a problem. Often we'll use a combination of antibiotics initially to cover more bases.
Are there ones to definitely avoid for meningitis?
Yeah, you wouldn't rely solely on things like basic penicillin or tetracyclines or the aminoglycosides like amikacin or gentamicin. They just don't penetrate the CNS well enough on their own for this specific problem.
And how long does this antibiotic treatment usually last?
It's long-term, minimum 3 to 4 weeks, often longer, maybe even 4 to 6 weeks, depending on the source you read. You really tailor it based on how the foal responds clinically and what follow-up CSF taps show.
Okay, so that handles the bacteria. What about the inflammation itself?
That's the second pillar, anti-inflammatory therapy. Now, this can be a bit tricky. Corticosteroids, like dexamethasone, can theoretically help reduce CNS inflammation early on. But using steroids in a septic foal is controversial. There's concern about suppressing their already stressed immune system, plus the risk of things like gastric ulcers. So it's used cautiously, if at all, with close monitoring.
What about other anti-inflammatories?
Definitely. NSAIDs, non-steroidal anti-inflammatories like flunixin, meglumine, banamine, or ketoprofen are standard. They help with fever, pain, and that general systemic inflammation. DMSO, dimethyl sulfoxide, might also be used. It has some anti-inflammatory effects, and some people use it hoping to reduce swelling in the brain, cerebral edema.
So antibiotics, anti-inflammatories. What's the third piece? The supportive care.
Yes, and this is absolutely non-negotiable and incredibly labor-intensive, intensive supportive care. This means continuous IV fluids to keep them hydrated, support their circulation. Nutritional support is vital. These foals are often too weak or neurologically impaired to nurse, so milk through a nasogastric tube, sometimes even IV nutrition, parenteral nutrition. If FPT was diagnosed, you give intravenous hyperimmune plasma to boost their antibody levels. You have to manage the neurological signs too. Seizure control is critical, using drugs like diazepam, maybe midazolam for immediate effect, or longer-acting ones like phenobarbital or maybe levetiracetam. If there's evidence of brain swelling, cerebral edema, you might use mannitol or hypertonic saline to try and draw that fluid out, and then just relentless nursing care, keeping their temperature normal, soft bedding, turning them frequently to prevent pressure sores, and just constant minute-by-minute monitoring of vital signs, neurostatus, blood sugar, electrolytes, hydration, everything.
That sounds truly exhaustive.
Yeah.
An incredible amount of care. Given all that, what is the actual outlook? What's the prognosis for a foal that develops meningitis, even with this level of aggressive treatment?
Yeah, this is the tough part. Honestly, the prognosis is guarded to poor. It's a really, really severe condition. The mortality rate is high, often over 50%, and some studies report it as high as, well, 90%. And like we said at the start, without treatment, it's rapidly fatal.
So even with the best care, it's still very touch and go.
Very much so. Several things impact their chances. How severe are the neurological signs when they present? Foals with really bad ongoing seizures or in a coma or with profound neurological deficits, their outlook is much worse. The timing is maybe the most critical factor. Getting that diagnosis quickly and starting aggressive treatment immediately makes a huge difference in survival chances.
Yeah.
The severity of the underlying sepsis matters too, of course, and how the foal responds initially. If you see some improvement in the first 24 to 48 hours, that's generally a more positive sign.
The specific bacteria.
That can play a role too, yes, as can any other concurrent health problems the foal might have. And even for the foals that do survive the initial crisis, there's a real risk of long-term neurological problems, deficits that might affect their future athletic career or even just quality of life.
Such a difficult condition, it really underscores the importance of prevention. What's the best strategy there?
Absolutely. Prevention is all about stopping that initial neonatal sepsis. That's the key. So it comes down to excellent mare management during pregnancy, really strict hygiene during and after foaling to minimize the foal's exposure to bacteria. And the big one, ensuring that foal gets enough good quality colostrum right away. Testing the IgG levels within the first day is ideal. You want to see that serum IgG concentration well above 800 milligrams per deciliter. That strong passive immunity is their best shield.
So today we've really gone deep into the immense challenges posed by neonatal foal meningitis. It just highlights how critical that early aggressive care is, and frankly, how fragile life can be at the very start.
It really does. Looking closely at something like neonatal foal meningitis, it's such a specific veterinary challenge, but it tells you so much about the fragility of newborns. And it highlights the huge cascading impact of just fundamental care, like ensuring that passive immunity transfer happens correctly. What does that tell you, really, about how interconnected health is, even in processes that seem biologically straightforward, and just what a profound life or death difference early decisive intervention can truly make?